the colon, the rectum, the common denominator, or the mysterious ways of the colon. You're going to get some good value out of today's discussion. And we're going to use some technology. Joining us soon, our good doctor from Health City. But here in the studio, just across from me, the marketing manager, the also world famous marketing manager at Health City, Miss Tiffany Dixon Ebanks. Good day. Good day.
Good day, Matt. Thanks for having me in the studio
As
again
always.
this afternoon.
As always.
It's funny how in 2022 we all think
Mhm.
about Zoom, right? But just to fill your listening audience in, Dr. Sunil had an emergency procedure this afternoon at the
I
hospital.
like it. I
So
like the
he was
drama.
so he was ready to he goes,
Mhm.
I'm driving up from Hell City now,
Mhm.
and then one of his colleagues called back and said, let's do Zoom because it is, most of the time is going to be gone in traffic. And then we said, well, telephone works as well because the old fashioned telephone, pick up the number, because if you had a caller calling in, that would be the quickest way as well to get through. So we're going to have Dr. Sunil call in your line the old-fashioned way, in order
I'm
to
here. I'm
ensure
here.
that he can participate this afternoon.
All right. Well, as we speak, I am hearing the good doctor on the line. Doc, can you hear me?
Yeah, I can hear you perfectly. Thank you.
Okay, excellent. Doc, we want you to drive carefully. But at the same time, we want your brain power in the show because this is a topic that relates to us all. We're talking about a well-engineered machine, the human body. It takes in food or fuel, extracts what it needs, stores some for later, maybe puts a little bit in our stomach, some fat for later, and then it excretes it out of the colon, the mysterious colon. It's a private place, doc. At least it's the most private place for me. So I assume you don't get many walk-ins. Not many people probably coming to you and say, hey doc, I just felt like coming to check you. Is that the case?
Yeah, we do
Ah,
entertain some walk-ins because it's an emergency.
so, oh yeah, that is the Caribbean way. When it's too late, when, when something has already happened, that's when we start to think about our health. We are talking with Doctor. Let me get the name correct. This is Doctor Sunil,
Yes.
and he is the senior consultant gastroenterologist down at Health City. Everything to do with the colon cancer, and this is something that affects us. A lot of families here in Cayman. You can get cancer anywhere. We were talking with the cardiologist, and he was saying that maybe the heart may be the place that you would not likely get cancer because of the muscle tissue, but it is unfortunately everywhere. So, colon of the cancer, but sorry, yeah, no, cancer of the colon. What is the colon made from, doctor? What is the type of tissue that is down there?
The colon has got a mucosal lining, just like when you open your mouth, you see that pink lining inside the cheek. Similar to that, the colon has got a lining inside that forms the inner lining or the first layer of the colon. The second layer of the colon is muscular. And the third layer is again a thin membrane, like what you find when you crack an egg, a small membrane. That's called the serosa. So we have the mucosa, the serosa, and the muscular layer. So three layers make up generally the colon structure, of which the cancer we are talking about is essentially coming from the inner lining, that is the mucosa.
So as you're speaking, doc, I can hear your car start. I heard the slight breeze down at Health City, the gentle breeze that blows over in East End. So, ladies and gents, just know that he
Boy,
he
you're
he
a Sherlock Holmes.
he was working probably in surgery, preparing for surgery, writing up a report from surgery. Doc, what was your, if you don't mind, just give us a little taste of what your day was like as a gastroenterologist. What were you up to today?
Oh boy, today the emergency I got into was a major bleeding from the rectum. So this patient was bleeding and bleeding. So we did some resuscitation, and then we thought that we'll take her up for hemostasis. Hemostasis is to stop the bleeding. We have got an endoscopic procedure for that. So we just finished that procedure and made sure that the bleeding has stopped.
Now, if you got a cut on your leg, what we used to do, we used to throw salt on the wound
Oh
and
boy!
and throw some mercurochrome on it. But I don't think that if you got if you had rectal bleeding, that would be the answer. So are you going in with a machine, or are you going in how are you entering the rectum, and how are you stop I know it. You explained it using a term, but just for us that don't understand the terminology, is this a patch? Is this the sewing of the rectum with stitches? How did you stop the bleeding?
Oh, yeah, that's an interesting question. Let me tell you. See, most of these blood vessels are hidden inside the lining of the wall, and she had a refractory kind of bleeding because all the preliminary work which was done for her to stop the bleeding failed, and she was referred here for an advanced therapy. What we did was something called the endoscopic ultrasound guided blood vessel injection. So they put in an endoscope which carried an ultrasound on the tip of it. So we could see through the wall of the colon. And
Hmm.
we could see a blood vessel which was around 6 millimeter in size, bulging out and perforating into a small ulcer in the colon.
Hmm.
So this vessel was localized by ultrasound, and through the channel of the scope, we put in a needle which went into the vein, into the vessel, and then we put in a coil there just to make sure that the blood clotted. So we put in a coil and then put in some sclerosant injection. Sclerosant means injections which aid in clotting, and that sealed it.
I mean, you're making me nervous just talking about it. But it's good to know that you are on top of your game. It's good to know that the patient has been taken care of. In general, you have so many tools at your disposal, and like I said, this is a private place. People rarely want to talk about their colon, their rectum, their anus, even saying it out loud. Everybody is tensing up a little bit. So, in general, let us say that I came into your office and you said, "Okay, let's do a procedure." Are you going to use a light? Is there what is the average person's checkup going to look like if they come to check you?
See, the average checkup is just your blood checkup or your stool checkup. You just check your stool and see if there is anything sinister there. For the complaints, they come to us from the rectum and the colon is basically one, pain, two is bleeding, and three is any kind of infection or diarrhea. These are things they come in for.
Mm.
So the primary thing we check out is not the endoscopy. We check out the stool first. We do the blood test first. We make sure that there is blood in stools. Even if it is hidden, we can find out in the lab test. We make sure if there is an infection, bacteria, parasites. All these things are checked first. And then once those basic investigations are over, then we decide on whether this patient needs an endoscopic evaluation or not. So once that is fixed, then we need some prep and time for that. We can't just barge into an OP and get it done.
Okay, and Doc, I'm going to just ask you to hold for 1 second because I'm here with Tiffany, who understands the value of adding these services to Health City. I think we were all at some time under the impression that Health City was the only the heart specialists. Maybe they did too much of a good job of marketing their heart services, or maybe they had all of these tools under their belt and they're bringing them out slowly. But Tiffany, can you just give us your reasoning behind just making so many procedures and specialities available to Cayman?
Yes, well, Health City, I think for those who've been listening to your programs here for a while will know that we are one of the branches of Narayana Health Hospitals out of India, which is over 30 different facilities. The founder, Dr. Devi Shetty, obviously well known and renowned heart cardiologist, surgeon, right? So because of what he's known for, it doesn't mean that we don't offer these services here at Health City in the Cayman Islands. So we've basically always offered each of these specialty services at Health City, gastroenterology being one of them. We have our oncology department. We had Dr. Vinitha and Dr. Rashmi in here talking to you the other day about those services. We have our ENT specialist who has recently joined us this year. We have, I don't think you've met Dr. Poojas yet, which is our gynecologist on our team. So we have a number of different specialties available at Health City. And I know that Dr. Sunil, you know, not able to be here because of a medical emergency. But the thing is, I wanted to kind of give your listening audience the background of who is on the telephone with us this afternoon. So I'm just going to read a little bit of his bio just so that you can understand when he's talking, the kind of background, the kind of experience he has bringing to this specialty area at Health City, Cayman Islands. So Dr. Sunil is our senior consultant at Health City, and he joined us in 2020 with more than 25 years of experience in interventional gastroenterology, which includes endoscopic colonoscopy procedures. He has been trained and is a postgraduate in India and has done interventional training in Germany, the UK, and Hong Kong. He has more than 20 years of experience in diagnostic and therapeutic endoscopy, and he is trained in third space endoscopy encompassing for submucosal tumors. So joining us with that wide range in terms of his experience so far, we were very happy to have him. I will also note here, because this was a novel experience that we had on our team. I had the pleasure of hosting a CME, which is a continuing medical education event. Now, we put these on all the time, which is our educational events for doctors and medical practitioners in order to gain their continuing medical educational points, right? Their CME points.
It doesn't stop, does it?
No, it's a
No?
continuous thing
Mhm.
that all doctors have to do. But Health City, we actually put those on as well. And Dr. Sunil, along with Dr. Deepak, who is also one of our consultant gastroenterologists, and he actually does our bariatric surgery area, were able to put on a live stream event so what he was talking about earlier about the endoscopy and the actual procedure and the emergency he had today, it kind of
Mhm,
sounded a little
mhm,
bit similar, although that one was
mhm,
prepped, not an emergency,
mhm,
where he was able to live stream from the hospital in East End,
mhm.
right? This procedure was actually live streamed to the doctors who were attending the CME event at the Kimpton Seaview Resort. And we also set it up in such a way that we allowed for dialogue, question and answers from the doctors who were there at the event watching this surgery or this procedure happening, with Dr. Deepak and his full team, right? So the full team was there on site, the anesthesiologists, the nurses, the medical technicians who were in the endoscopic suite at Health City in East End.
I would have bought a
So
ticket. I mean, I think that there is so much at stake. There's so much risk involved. There's so much skill involved
Mhm.
that it is. If you can watch professional boxing, I would be very open to watching surgery. Doctor, are you still with us?
Yeah, yeah, please, I can hear you.
Okay, very very good. Um, just my from my basic understanding, there is different categories. You go from the stomach to the intestine, I to the rectum. Where is where? What is what? When does the rectum turn into the colon? And just help us to label the digestive tract properly.
Oh boy.
Well,
uh,
you can't do it without pictures.
yeah, to picture it out, it's not easy. But then let me